Hiya. So we're going to work on an exercise called the one leg stretch. I'm going to show you 3 progressions from easy to slightly more difficult. The purpose of this exercise is to engage the deep spinal stabilising muscles. So we're moving a leg, but what we're aiming to do is keep the spine and the pelvis completely still. So we're having to really recruit those deep spinal stabilising muscles to do that. I will also run through a couple of muscle isolations that are particularly important to riders, specifically of the corset muscles. So we've talked about that lateral side-to-side pelvic stability and that rotational stability, and the role that the corset or the oblique muscle has in those things. Okay, awesome. So what we're going to do is we're going to start in this position. So we know how to set up our start position. Lovely. So what I'm going to ask Hattie to do is just put a hand on either side of the pelvis. Lovely. And that's so that you can have a really good feel of what the pelvis is doing from side to side. So if we tip the pelvis, we feel that and we know to then correct it. So one leg stretch, the easiest version of this exercise is to keep one leg completely still. Really slowly, take a nice deep breath in. And as you breathe out, slowly just push that right foot away from you, just sliding it along the mat, straightening that leg only as far as you're comfortable, and inhale back. Lovely. And you're balancing that tray of drinks on the pelvis, so there's no movement. So that was nice. Lovely. And then exhale, left leg away, keep the right leg completely still. Good. Really nice through the pelvis. And inhale back. Good job. Lovely. That was really nice. Okay, so obviously you might do 10 each side, however you want to work that. So the things we're looking out for with this one, as you stretch the leg away from you, so just do it once more for me, Haz. There's a couple of things we can do. Now the first thing, so if you just totally relax and just let your pelvis do whatever, the first thing is that the pelvis will drop on that side. Okay, so you've got to focus on keeping that up towards the ceiling, and you're having to use that corset muscle there. Another thing is the back will hollow or arch away from the mat. So tuck the tailbone and just make sure you've got control and you're still in your neutral spine, okay? So it might be, particularly if you're tight through the front of the hip, that you can only get the leg to that position, and that's absolutely fine. So if you take it all the way, what will happen is you'll arch your back away from the mat, and you know you've just taken it too far. So keep that knee on a slight knee bend, okay? So that's the first level. Second level is to bring one leg up into single leg tabletop. Okay, lovely there. Again, we've got a tray of drinks on the pelvis. Just soften those ribs. Remember that spring in between rib cage and hips. So this time, take a nice deep breath in. Exhale, straighten the leg towards the wall in front. Imagine you're going to turn a light switch off on the wall in front of you. Lovely. And inhale back into single leg tabletop. And again, exhale, push that leg away. And inhale back. So slightly more difficult, and we can see Hattie's struggling to control the pelvic stability. So this time push the leg away and inhale, hold. So you're going to tuck that tailbone, slide the rib cage down to the hips. So you've got that spring there. Bring the right side of the pelvis to the ceiling and tuck tailbone. So now we're level through the pelvis, okay? We're not arching the back. Good job. And just relax that leg down. So those are the muscle isolations we're going to work through. We're going to do it again. I'm going to progress her further. I'm going to hold Hattie's legs in the right position because I think she's going to find the next level a little bit tricky. All right, so we come into double tabletop. So always take your legs into double tabletop. Let's start again. Take the legs into double tabletop one at a time. Don't rush this. You take a nice deep breath in. Exhale, float one leg up into tabletop. Inhale, hold. And exhale, float the other leg up. Lovely job. So I'm just going to put my hands in here. So we want a 90-degree angle at knee and hip, all right? We make sure we're level pelvis, we're soft through the rib cage. So what we're going to do, in fact, I'll just pop one leg onto mine. So you can actually make this easier by having like a gym ball or something underneath the legs if you're not able to control for it. If I just keep my leg here, Hats, you're going to hold this leg into tabletop. Okay, I'm going to let go of it now. Good. So take a nice deep breath in and exhale. Just straighten that leg towards the wall in front. Imagine that light switch. Turn it off and inhale back. Good. And again, exhale away. And this time we'll inhale, hold, tuck the tailbone. Rib cage down, really nice. Right side of the pelvis to the ceiling, tuck the tailbone. And exhale back. Good. And relax your legs down. Fab. So obviously you might choose to do 5 on each side, up to 10. See how you get on. Obviously, if you're feeling a little bit stronger, you can do more. You can make it easier by bringing, if we come back into tabletop, if you just straighten that leg away, good. If you bring the leg slightly lower, that's going to be more difficult. If you bring it up towards the ceiling and bend the knee slightly if you need to, easier. Okay, so you can make this more difficult or slightly easier if you want to. Remember, these exercises may not be appropriate for you, so if you have got any medical history and you're not sure, please feel free to contact me. You can contact me via the Chaps Physio Facebook page or Instagram page. Of course, give them a go if you're happy to. You can film yourself, post them on social media, tag Chaps Physio, and remember to hashtag Team Chaps. Thank you very much.